Hi, my name is Steve Eady. I'm with the Sauk Valley Voter Fair. It's actually going on right now, and we're with Dr. Will Boyd, who is running for U.S. Senate as independent, and we're going to ask him a list of questions to get his opinion on some things. So, first, welcome.
Thank you so much.
And the first question is really about what are your ideas on how to reduce spending in Washington?
I'm a fiscal conservative and also a compassionate conservative, which means that I believe in the necessity of shrinking our debt, but at the same time I recognize that there is necessity or value to some social programs. I believe one of the first things that we have to do is ensure that we are employing people, putting people back to work. Ultimately, I believe as people pay more taxes, not an increase in taxes, but pay more, obviously we garner more revenues. So I believe, first of all, cutting taxes is important. I would say that we need to cut back, first of all, on the Bush tax cut for the rich, allow the rich to be able to also share in this burden. Once those individuals are able to contribute also, it would also lift us out of the debt that we're in. I believe that being a fiscal conservative person, that we need to make sure that any programs that are not proving that they're feasible and effective need to be cut off, need to be stopped today, immediately. I believe also that you must freeze spending in order to prevent us from going further out. Lastly, I would say that we need to grow the economy by ensuring that we push more smaller jobs or smaller businesses outside the country to increase the exports that are going out rather than imports that we're purchasing ourselves. So trying to remove the unfavorable balance of trade would put us in a better position.
Would you be in favor of any sort of legislation that would cap spending, such as tie it to GDP or anything that would just constitutionally not allow Washington to just write blank checks?
Absolutely, absolutely. I'm not, being a business professor and a college dean, I do not believe you reward businesses for failing. I believe you must ensure that businesses are able to demonstrate some level of competence, including the federal government. Again, if programs aren't proving that they offer a certain rate of return, or return on the investment that we've pushed into it, not meeting certain initiatives, criteria, should be cut off after investigating it, looking at it.
What are some positive and negative aspects of our healthcare system today, and what do you see as your vision for healthcare in the United States?
I believe some positive aspects of healthcare would be Medicare, in that it allows seniors and people who are obviously beyond the age of 65 to have some type of health care. I run into too many people who are regrettably without insurance trying to make it. We have a recycling program. I'm a city councilman in Greenville, and I often run into senior citizens who argue that $8 more in a recycling program can push them over budget. So just having, obviously, the ability to buy into insurance or the ability to have access to health care, hospitalization, and medical is great. What would I do for the healthcare system? I would first of all support a program that reaches out again to seniors and those who are less fortunate, which means that I would reach out to many of the people that the current administration is reaching out to, 94% of the population. But I offer a program that's about half the cost. My idea for health care would be a community-based health care center or system where federally qualified health care centers that are recognized as fiscally responsible, able to handle certain medical problems by the federal government recommendation, are able to, in communities, offer health care to individuals. What does this do? This allows people who are working, obviously, good jobs with good insurance plans to keep the plans they have, to, with the cafeteria plan, pick and choose what works best for them. But at the same time, it allows them to be able to say, obviously, we can offer, the government that is, insurance to people who don't have it at a very low cost. You're also employing doctors who are out there now, unemployed. You're employing nurses who can't find work in these centers, and you're employing people in the community to help manage the centers as well. So we want to offer in our Boyd Doctrine, as you heard me earlier, rolling out to the public, we want to offer a plan that will ultimately present health care at a lower cost. I am proposing that about $400 billion, we could touch every state and give them adequate health care without it being a major burden to anyone outside of the system that's on their own insurance now. I believe the plans that are being proposed are well. I believe we're seeing an enhanced plan, a premium plan, a premium plus, 4 different plans altogether. But the problem that I see that exists today with our health care is there is not something similar to a public option. Do I believe the current proposed public option is the best route? No, I don't. I believe there's some fine tuning we need to do with it. But public option does something that's important for, again, a business person. It presents people with the opportunity to work with more than one healthcare provider. As you have competition, the cost of healthcare will drop or go down, presenting people like you and I, consumers, people that are working with an opportunity to not be continuously pushed around by the larger companies whose goal is ultimately just to make money in some form or fashion. With that being said, I don't want to be accused of talking on both sides of my mouth. The business hat being placed on now as a professor again says if we push too far in the current health care proposal to just make sure that everyone's covered and push to make sure pre-existing conditions are irrelevant, we cover everyone to the point that insurers feel like there is no profit in offering health care, you know what happens. We suffer from brain drain. Not only do doctors and nurses pull out when there is no money available, as they're doing already, but sooner or later your Blue Cross and Blue Shield and others behind them will pull out. So HMOs, PPOs will be nearly non-existent because people will find no incentive in offering insurance.
Okay. Let's switch the topic to cap and trade. Do you oppose or in favor of cap and trade?
I oppose cap and trade.
Okay, why?
Well, the main reason why I oppose cap and trade in general, from a general perspective, is I don't believe companies should have the ability to buy their way into just allowing anything to come out of their smokestacks. I'm an engineer also, and I've spent many years working in plants. I've worked with OSHA standards and regulations, Occupational Safety and Health Administration, making sure that the rights of people, or at least the environment is right inside the facilities, but there's also an importance in making sure that people who are stakeholders to the facilities, everyone who stands to be in a position where they're favorably able to receive from the business by way of purchasing a product or service, or just somebody who dwells in the community is taken care of. Cap and trade, in my mind, basically just allows people, again, just to buy time, to say that they can get in and do whatever they need to do.
One of the things that we asked, and to be fair, you didn't get these questions in advance like all our other candidates did, so you couldn't research a lot of these, but I'm going to explain the next question.
Sure.
It has to do with the idea of why cap and trade exists and why there's a lot of rush to do legislation to cap CO2.
Sure.
There was an article that was released in August 2009 from 2 MIT professors that was peer-reviewed in the Science of Geology magazine that basically showed that all of the UN models for climate change are actually inaccurate. What they showed in this research was they took 20 years of data from satellite data on heat, and the UN model goes that greenhouse gases will captivate heat in the earth, and therefore heat will rise, and it's because of man-made CO2. And what this study showed is that as the earth warmed during the 90s, the actual ability for Earth to dissipate that heat out into space actually moved with the rise in temperature.
Correct.
So in other words, the more the Earth heated, the more heat was dissipated.
Absolutely.
So we wanted to get your reaction to that study.
Sure.
And kind of your thoughts in general on the concern that a lot of people have with global warming.
Sure.
Also on top of that was something you are familiar with because it was all over the news, East Anglica Research Center that UN got a lot of his data from found out that if it wasn't downright fraud, it was at least the visual cues of most people to say there's something fishy going on
Absolutely.
here. They're kind of manipulating the data a little bit to get their government grants. So I want to get your opinion on that, your thoughts on global warming, what you would do as a candidate, and I guess to end that, and I'm going on here a little bit because you didn't get the data, you didn't get it ahead of time, so you couldn't research it. Was that Illinois is rich in resources. Very rich in resources. We found that we got oil reserve down south. We got coal. We had 10,000 people working in the 1980s. Now there's our 50,000 in the 1980s. Now it's 10,000 today in coal. We have nuclear. We have more nuclear power plants than almost any other state. We have biodiesel. We
Mhm.
have wind farms up north here.
Mhm.
We've got so many things. And
Sure.
I just want to get your thoughts in general on energy
Sure.
and our dependence